Okay, pleasant day, dear doctors. Allow me to share this short talk with you regarding testmanship, how we basically crack the boards, and how we basically prepare for a test. So this is regarding test preparation and strategies. Now, we always begin with lesson number one. Now, a lot of doctors, a lot of students actually tend to forget this amidst our hectic schedules in our desire to prepare for an exam. I always tell my students that lesson number one, which is actually the most important lesson, is that you have to begin with prayer. You should not begin your journey and your efforts in studying unless you pray. Trust me, when the exam is very near, kung malapit na yung exam, usually you start praying. You start novenas, you start going to church, visita iglesia, you start praying to saints you've never prayed to before. I want to remind you that you should pray, not because you want something in return, but you want to pray because you believe. Put that as the most important lesson. Now, in this short talk, I have nothing to disclose, no financial conflict of interest. And I want to remind everyone in attendance right now that we should always begin with the finish line in mind. Before you prepare for your licensure exams, your subspecialty exams, after you know lesson number one, which is to pray, then tell yourself it all begins with the finish line in mind. In other words, tell yourself that you will get your license, you will get your specialty exam, and you will succeed. Now, before we talk about testmanship, this is a common concept or definition amongst many students. There's this meme that the word studying actually was derived from the two words student dying. Now, I'm sure that all of us have had our experiences, both good and maybe bad, or experiences that we might want to forget, most especially when it comes to studying. We've probably had our own share of bloopers, our own share of exams, which we might have not prepared well for, our share of exams where we did well, and our share of exams where we should have done better. Now, these are the basic objectives of this talk. First is to define testmanship. Second is to describe the steps towards preparedness for the tests. And lastly, to discuss some test-taking techniques and strategies. Now, for streaming purposes, I will divide the talk into two small modules. So let's begin with the definition of testmanship. Now, testmanship is defined as the ability to use certain characteristics and test-taking situations. Okay, so we have the ability to use characteristics of tests and test-taking situations to reach the full potential of one's knowledge and aptitude. Now, if we are to give a shorter definition of what testmanship is, it is simply test wiseness, how to be wise during a test. And this has two phases. One is the test preparation. Second is the actual test itself. So let's begin with the test preparation. I already mentioned lesson number one earlier, and I'm going to repeat it again. Everything starts with prayer, and that is lesson number one. Now, lesson number two is you have to tell yourself that you love what you are doing. You love your chosen field. I love surgery. I love orthopedics. I love internal medicine. I love neurology. You have to love your work, because if you begin your test preparation with the wrong mindset, then the challenge will become more difficult. So just like my good friend Steve Jobs said, the only way to do great work is to love what you do. Even if you don't like studying, Tell yourself that you want to become that specialist that you have trained for, that specialist that you deserve to be, and that specialist that your future patients deserve to have. Now, let's remind ourselves that there are no shortcuts. So we will really undergo a rigid experience, both mentally, physically, emotionally, and even spiritually, and at times financially. Now, in your seats while you're watching this talk on testmanship, I would like to request that we read this exercise together. Now, tell yourself, the louder you read this in your seat or in your home, the bigger your grade will be during your licensure exam. So at the count of 3, please read this with me. 1, 2, 3. A crinkle jup was parling a tristle bin. A bar jam stipped. The bar jam group, hey minto, to the crinkle jup. The crinkle jup, zis zoily. Now, I have a very simple question. Did you understand what you read? So with the use of your reactions, your icons here on Zoom, please let me know whether you understood what you read. So there's a simple lesson here in this slide. This is how we perceive our textbooks. This is how we perceive our notes, our handouts, and our reading materials. So I want to leave you with this message. Anyone can read, but reading needs comprehension. Wala namang purpose if we continue to read dozens of pages, dozens of handouts, dozens of sample exams, and you don't comprehend or understand what you are reading. Now, the basic rule for taking any standard exam is to be prepared. And there are things we have to take note of. Number 1 is the intellectual preparation. This is what the standard student, the standard teacher, the standard mentor or professor would prepare their students for. And that is the intellectual preparation. Mind you, I would like to reiterate that this exam, your licensure exam, your specialty board exam, is not a test of mere intelligence. It is a test of your character. It is a test of your faith. It is a test of your grit. It is a test of your resilience. It is a test of your discipline. So this is not only an issue of intelligence. There also has to be the physical as well as emotional preparation. The second preparatory part is what is usually forgotten when a student prepares for their examinations. Both of these cannot be separated from each other. They are like Batman and Robin. They are like John and Marcia. Okay? They need to go together. They are conjugal. Now, as for intellectual preparation, we get this through mastery. Okay? This is through mastery, which implies a well-organized understanding. So let me repeat that. A well-organized understanding of the subject matter. So what does that mean? Kailangan balikan. You have to repeat. In the ideal setting, you need a first reading to familiarize yourself with the materials. The second reading to start recalling. Then, ideally, second or third reading for mastery. Now remember, repetition leads to mastery and not repeating the board exam. Repetition leads to mastery. Kailangan balikan. You have to go to the materials. But let's be honest with ourselves. Out of 10 students, there's probably 5, 6, 7, or even more who would enter a testing site with reading only once the prescribed materials. Now, always remember, intellectual preparation is grounded by repetition. So the process of intellectual preparation basically allows us, okay, for long time learning and retention. It also allows us to have room for good methods for revision. If we don't understand it, then we repeat it. And it will give us a good idea as to the exam's purpose and format. Now, what about the other preparation, which goes as the foundation for testmanship? It's the mind and body. So always remember, having a healthy mind and a healthy body goes hand in hand. Why? Even if you read the book 3, 4, 5, 6 times, your body is not healthy, your mind is not healthy, magba-blackout ka. You will get a mental blackout. You will deteriorate physically. You will deteriorate medically. So what will happen is you might actually not be able to recall what you prepared for. So please take note of that. Now, you have to eat well. You have to sleep well. Ang problema dyan is during preparation for exams, we usually sleep too well. Okay? More time or hours sleeping rather than studying. Now, I'm not sure if you're aware of this, but there's what we call sleep debt. May utang tayo. May utang tayo sa pagtulog. So the sleep debt leads to decreased short-term memory. Have you ever experienced yung toxic duty? Yung sobra yung toxic yung duty. When you tend to forget things, you tend to make mistakes, there's mental lapses. So there's decreased short-term memory. Sleep debt also decreases learning performance. Sleep debt also suppresses your immune system. So as you prepare for your exam, you need proper sleep hygiene. So number one, if you are going to sleep, theoretically, the bedroom should be dark. Why? The presence of light will disrupt the production of melatonin. This will be responsible as the hormone which regulates your sleep pattern, your diurnal sleep pattern. Remember, if it is dark, melatonin is produced and it tells us it's time to sleep. When it is light, then our brain is told that we should be awake. Now, do not study while you are lying in bed. I learned from a professor, a very wise professor, that the bed is only used for the following things. Number one, to go to sleep. Pangpatulog. The bed is only for sleeping. The bed is only for lovemaking, and the bed is only for those who are not feeling well. The bed is not your study table. Okay? Now, the bedroom is for sleeping. If you have too much technology in your bedroom, it will affect your sleep, and it is not anymore an environment conducive for sleeping. Now, what about the emotional preparation part? You have to be at peace. Hindi pwede may distractions tayo. There should be no distractions, whether it be work, let it be relationships, unsettled issues, because this will affect your study preparation. Avoid anxiety and be in the beast mode, but the beast mode in a good way, which means determinado. You have to be determined, because it is your determination which will help determine whether you will reach the finish line. So remember these core values: attitude, discipline, and preparation. If you remove any of these three, chances are you're not going to pass, or chances are it will be more difficult to pass. All three should be there: attitude, discipline, preparation. Now, how many of you study like this here below, wherein everything is highlighted in yellow? Wala namang problema if your notes, your books are jaundice. However, the purpose of highlighting, underlining is to highlight or basically emphasize on what is important or what should be remembered. Now, for the learning style, a lot of people ask me, why don't you just tell us how to talk about or teach us the tips how to answer a multiple choice exam question? Remember, before you go to war, there are logistics, there is strategy. You have to understand yourself first before you go into war. Because most of the time, during your study preparation, during your journey of preparing for a licensure exam, you will realize your greatest enemy is actually yourself. Your greatest stumbling block is actually yourself. So aside from your faith, aside from your family, friends, and support groups, the person that will literally get you across that finish line is yourself. So now we have to dissect thyself. So ask yourself now, what is your learning style? So determine what your learning style is. Are you an active learner? Are you a reflective learner? Are you a visual learner? Are you a verbal learner? Or in most cases, are you a combination of more than one style of learning? Why? You cannot impose the same study style on every student. Kailangan tailor-fit, individualized. You cannot study like your seatmate. Iba-iba yung pacing when people study. You have different academic backgrounds. I presume you're exposed to the same specialty training, same clinical exposure, but when it comes to academics, not everyone is on the same page. However, you have the same goal, and that is to pass your licensure and specialty exams. Now, try asking yourself where you belong. Who are the active learners? These are the people who like to apply lessons in real life. These are the people who love to correlate and apply it into what they saw in the hospital, what they saw in the operating room, what they saw in the outpatient department. And they like to discuss lessons with others. And always remember, the fact that you can discuss it with others, that's already a form of teaching. These are the learners who enjoy discussions and group problem solving. Now, are you a reflective learner? The reflective learner needs time to process. Pinag-isipan pa. They are still thinking about it. Okay? And they need time to process what they just learned. So the reflective learner needs to see the forest as well as the trees. These are the people who tend to prepare a notebook, post-it, highlighters, a little piece of paper at the side, and they make notes of what they are studying or what videos or lectures they are viewing. The reflective learner appreciates it when there is a pause after learning. Now, tip, do not oversaturate. Oh, your exam is a few months from now or a few weeks from now. Do not burn out because your efforts will be useless. You need to pause when necessary. And I will talk about that in a while. The third type of learner is a visual learner. They love to recall things with regards to images in their head, pictures. For surgical subspecialties, you need these pictures, these images, and you need the experience, the hands-on, because you tend to remember actual cases that you saw, actual cases that you handled. So you prefer to use pictures in lessons. So always remember, the visual learner tends to pay more attention to pictures rather than words. Now, lastly, are you a verbal learner. The verbal learner recalls details in terms of words. They focus more on the words rather than the picture. Now, at the level of a licensure examination, postgraduate licensure examination, I strongly encourage you to be a combination of both visual and verbal. Okay, now these are the study tips you have to remember. Time management. Please avoid cramming. Take note, I said here, at least minimize cramming. I would be a hypocrite to say that students do not cram in one form or another. We have to minimize, okay? Avoid mismanagement of time. Now, this is your picture when you prepare for your licensure exams. Cramming is your mortal enemy. And always remember, sadly, cramming is the usual habit of a stereotype student. Now, look at this. How much time you spend studying? This is preparing to study. Look at this in the pie chart. Telling everyone you have to study. Oh, this is funny. Look at that. Malapit na yung exam. Magtatap tayo. We have to do well in the exam. And this is the time spent actually studying. Now, ask yourself right now if you are guilty of this. Okay? I myself, as a medical student, I myself, as a postgraduate student, as a resident, as a fellow, and even as a consultant, I'm still guilty of this. So you are not alone. But we have to fix things, and we need to be masters of personal study schedules and time management. Now, I would like to suggest to you to do the reverse calendar method by Dr. Toom. Now, what do we mean by this? Step number 1, identify when is the date of your big exam. Okay, when is the date of your big exam? So let's just say, for example, lang, it is August right now, and let's say your exam is December. You count how many months, and from that, you go reverse calendar. Okay, that means that is your timetable, which means within the first month, I need to cover these specialties or these regions or these topics or these subjects or these procedures. By the second month, I should be recapping what I did in the first month. As the exam gets closer, probably a week or so, then I will start studying sample questions, and I will start studying tips from my seniors, my friends, my consultants. Then you get closer to your big day. Now, make sure you have the best references in textbooks, which means every specialty has a Bible. So you have to know what your best references are. And do not start your review process or your study process unless you have all of these references and textbooks prepared. Next, I'm going to introduce you to another study technique. This is what we call the OK4R method of reading and the note-taking technique. So let's start with the first. So what is the OK4R? It starts with overview, the ideas, read, recall, reflect. Now, the most important part here is this. It is the read, recall, and reflect. Do not recall yet or memorize unless you read and comprehend. Do you still remember that exercise we had earlier at the start of this talk? The crystal bin, the bar jump, mint, hey minto. So you will realize, kahit nagbabasa ka, you're highlighting, you're reading, It doesn't make sense if you don't comprehend. Okay, so again, read, reflect, recall. So read, recall, and reflect. And lastly, you review. Okay, now, what about for the note-taking technique? Number one, you have to record. Record whether on paper, record whether on voice, record on your gadgets. You have to reduce, which means don't take note of everything. Do steno noting and only take note of the key points and the highlights. Recite. If you're alone, you can recite out loud, but never recite out loud if you have a study partner or someone else living with you, for example, in a dorm. Unless you are taking a break and you are asking each other questions. Then, of course, you need the reflect. So what is common with these two study techniques? There is review and review. In other words, do not head to your licensure and specialty exam unless you review what you are studying. So always remember, with these two study techniques, there's original learning, there's early revision, there's intermediate revision, and there's final revision. And this leads to repetition. And what does repetition lead to again? It leads to mastery. Now, additional study tips. Highlight only the key ideas. Do not highlight everything in your books and handouts. You skip concepts that you already know. Study diagrams, read the notes, especially in tables and figures in textbooks. Always remember, in standard medical textbooks, when there is a figure, a diagram, or a table there, that is usually discussed in the paragraphs. So read the descriptions of diagrams and figures, because board examiners, specialty examiners, have a habit of lifting questions from the diagrams and the figures. Make a formula summary sheet. Okay, so you summarize what you're jotting down. Make general summary statements. In other words, reminders to yourself that this is the key concept of what I just summarized. Recall rather than reread. Now, use most of your senses. When there's difficult concepts, okay, you might want to read it out loud. You might want to recite it out loud. You might want to perform it with your hands. You might want to visualize it. You might want to use your body as an atlas. Anatomic, surgical. This is the forearm. This is the medial epicondyle. This is the lateral epicondyle. What group of muscles are attached to the medial epicondyle? What group of muscles are attached to the lateral epicondyle? This is the midshaft of the humerus. What nerve will be damaged if there's a fracture of the midshaft of the humerus? This is the surgical neck. If there's a fracture of the surgical neck, what structures would be damaged? Is the quadrangular space there? Does the posterior circumflex humeral artery pass through there? Does the axillary nerve pass through there? There is a patient who presented with a tennis elbow, a patient who presented with a golfer's elbow. What is the clinical presentation? What is the management? What is the surgery? So these are just examples where you have to visualize, you have to use your body as an atlas. Now, additional study tip. Schedule your study time. Dapat focused. Once you have distractions. So if you have responsibilities, example, in the hospital, at work, then you have to use the time in between to study. Once you are cleared, you don't have any more exams or any more duties rather, or hospital obligations, then it's easier to study. So what do? You schedule your study time into 1.5 to 2 hour blocks. Do not go straight more than 2 hours. Study vigil, 3, 4, 5, 6, 7, 8 hours. You are a human being. Even machines will break down. Leave time for breaks. Next technique and tip is, since you're taking a multiple choice exam, Gather sample exams, old exams, use it for practice. Now, highlight only the keywords in the correct answer. Try not to form memories of the wrong answer, but rather the correct answer. When you are reviewing, look at the correct answer, and this is the technique. Explain why it is the correct answer, and bakit kaya yung iba, why are the others wrong? And warning, do not study old exams or samplex unless you are finished with your theory. Now, take time after you take note of these study tips, look at the mirror. Why? That is your competition. The person you see in the mirror is your greatest enemy. That person can either make you self-destruct or that person can make you succeed. Now, testmanship during the pandemic. Another challenge right now is online learning. Yung problema dyan is the attention span. That is why split your study into shorter periods. Do not go more than 2 hours. Every 20 minutes, we have the 20-20 rule. So every 20 minutes, you look at something which is 20 feet away. For example, an object, okay, like a light switch. Focus on that object for 20 seconds. That will reduce eye strain. That will reduce online fatigue, Zoom fatigue, Google Meet fatigue. It will also help you maintain your attention span. Now, take pocket breaks during studying and plan ahead with lectures you will be attending, self-study in the books, and exam schedules. Now, I want to introduce you to this Pomodoro technique. Some of you are probably aware of this already, but this is very, very useful. Step one of the technique, decide on the task that you need to do. Okay, in this case, I need to pass my specialty exam. Next, set the timer to about 25 minutes. You can set it to 30 if you want. Once it rings, okay, that is your cutoff, and you have to take a break. So set the timer, 25, 30 minutes, then you work at the task on hand. Once you hear that timer or that ring or bell go on, then it's time for you to take a break. Short 5-minute break, 10-minute break. After cycles, 4 cycles to be specific, take a 15 to 30-minute study break. So as the cycles increase, your break increases. So this is, again, the Pomodoro technique. Now, another pitfall of your challenge now of studying for a licensure exam during the pandemic is motivation. Why? If I were to tell you that there's a new series on Netflix or a new telenovela series or Money Heist is back on, you'd probably finish the entire series. Magpa-promise ka isang episode lang, but you're gonna end up finishing the whole series. Oh, The Good Doctor season 4 is on. I'm gonna watch it. Motivation becomes a challenge. Why? It's a pandemic. There's enough mental, physical stress already. Dagdagan pa with the challenge of studying. Okay? So everyone has some form of pandemic fatigue. Now, what about your examination day? Don't forget the following. Eat. Why? Your blood glucose levels needs to be adequate because your brain utilizes glucose as a fuel source. Bring a wristwatch to help you pace during the exam. Light snacks and water as allowed by your proctors and your testing sites. Bring candy with you. Menthol, White Rabbit. White Rabbit has a very good glucose source. Menthol soothes the airways and basically helps keep you awake. You might want to bring some stimulants. Vicks inhaler, Chinese bomb, white flour. Okay. Next, prepare what you're going to wear for your exam. And remember integrity at all times. Getting a 0 is better than a cheated 100. We are physicians, integrity at all times. Pay attention to the proctor and do not leave anything blank. There is no point deduction if you leave an answer blank. That's why make sure no answers are blank. There's also tendency to have mistakes in transcribing when there is a blank answer. Budget your time. Okay, mark unanswered questions, make a little check in the questionnaire, or if you're not allowed to make marks on the questionnaire, you might want to fold the questionnaire, put doggy ears there, so you're reminded that, oh, I have some unanswered questions. Balikan ko siya. Transcribe carefully. My strong advice is in a multiple choice exam question, do not answer, then shade the answer right away, answer, then shade right away. Why? It is impossible you will get the correct answers from 1 to 100. For example, answer first, because sometimes there are succeeding questions that helps you realize that there's actually a better answer. That's why transcribing is later. Now, after the exam, okay, take a well-deserved break, eat nutritionally, celebrate and give thanks. Strive for excellence and always remind yourself, okay, always remind yourself that if you fall short, why? You tell yourself you're going to top the exam, okay? Even if you know you cannot, tell yourself you're going to top the exam, because if you fall short, at least you will pass, okay? So